microbiomes. So microbiomes is living microorganisms of bacteria, viruses, fungi in our body, and the biggest population of this lives in our gut. That's why you see this intestines right here. So most of our microbiomes, first, Hippocrates said all diseases begin in the gut. So most of the microbiomes right here, a combination of good and bad bacteria, about 70% of it lives in our gut. So this, what Hippocrates true and right. So which means if the disease begins in the gut, the healing should also begin in the gut or in our digestive system. And this microbiomes here has to have a balance of the good and the bad bacteria. It is when the bacteria gets out of balance, out of the normal balance, that infection sets in, diseases come in. So it's really very important that we take care of what we eat. So are we thinking about a healthy diet or a healthy or unhealthy? Okay, healthy or unhealthy. So the food you eat can either be the safest or the most powerful form of medicine or the slowest form of poison. True. That is very true. And did you know that digestion starts in the brain? The brain has a direct effect on our stomach and intestines. The very thought of just eating can release the stomach's juice before the food even gets in contact with our mouth. You know that? Have you ever experienced that feeling of in your gut, feeling of butterflies in your stomach? That's how they say it, butterflies in the stomach. It's because our brain is connected, our stomach is connected to the brain and the brain connected to the stomach, vice versa. So it's connected by a vagus nerve, one of the biggest nerves, and also neurotransmitters. So whatever we eat can affect our moods, can affect our health. And whatever we're thinking about food, it gets transferred to our stomach already. That's why you get that butterfly in the stomach. Supposing you are going for an interview and you get nervous, you can experience that because from your brain, you're emotionally stressed. Your stomach can feel it. So our digestive system is about 30 feet long, and it is our first line of defense because I had mentioned that 70% of the microbiomes are located in our gut, meaning to say that is the first contact of our body from the outside world. We put the food in our mouth, we put it in, it goes down to our esophagus, goes to our stomach, and then to our intestines. And so there you go. So from the environment inside our body. So that's why it's very important to take care of our digestive system. So once our food goes to our small intestines, it's then absorbed inside this. This is our small intestine right here. And this is how it looks inside it, the villi. There are lots. You could see all this looks like little fingers there. So it's absorbed, the nutrients are absorbed over there. Okay? And now let's talk about the immune system. After we have talked about the digestive system is our first line of defense of our immune system. What is an immune system? Immune system includes white blood cells, organs and tissues, lymph system, like thymus, spleen, tonsils, lymph nodes, bone marrow. So it's a complex network of cells. The substances they make that helps the body fight infections and other diseases. The nutrients that help boost our immune systems are vitamin A, vitamin C, vitamin D, zinc, and protein. And you can also see right here that what are the keys to immune system health besides the nutrition? We need rest. We need about 8 hours of sleep per day. Night sleep is very important in our health. Exercise is another way to boost our immune system. Because exercise can also help with digestion. It helps muscle tone. With a better muscle tone means better digestion. Better digestion means strength. So a healthy diet helps protect against malnutrition in all its forms. This malnutrition, sometimes when people hear the word malnutrition, they think about a very thin, wasted skin, something like that. Malnutrition can also mean being overweight, or it could be lacking some nutrients like vitamin deficiencies, some sort of like that. So that is also a form of malnutrition. So healthy diet helps maintain and improve overall health. And how do we do that? If we take a look at this healthy eating plate right here, we have seen that the vegetables and the fruits should occupy half of your plate. More vegetables than fruits. And then we need some whole grains, like whole wheat bread, whole grain pasta, brown rice, limit refined grains like white rice or white bread. One of the best whole grain also is the quinoa. Corn is also a whole grain. Oats is also a whole grain. The healthy protein, right? Just healthy, not just protein. We need to choose fish, poultry, beans, and nuts. More of the healthier side. They are lean. They are not fatty. Limit red meat. You can have red meat, but limit it. Limit cheese as well. Avoid bacon, or limit bacon if you cannot avoid it. Cold fats and other processed meats. You can see here it says stay active. And eat plenty of fruits of all colors. The more colorful you make your fruits for the whole week is better, because you get the phytochemicals from different sources, not just one fruit. One fruit can only give you some nutrients, but if you make it a variety of fruits for the whole week, you will be able to get more of the nutrients that your body needs. The veggies, the greater the variety, more colorful, the better as well. Healthy oils, not just any other oil like that. Olive oil or canola oil is one of the healthiest oils. We limit those that are with trans fats or the solid ones, because that can trigger or cause some health problems, especially the heart. Now, here is our unhealthy diet, and what is the morbidity rate there? High intake of fast foods and processed foods increases this health risk, cardiovascular diseases, cancers, and all other diseases that is really very harmful and very risky for our body. Inadequate consumption of fruits and vegetables increases the risk of cardiovascular disease and some cancers, like I said. And cardiovascular disease accounts for 1.7 million deaths a year. That's a big one. Scary. So how do we go about this? We need to limit the intake of ultra-processed foods, because eating ultra-processed foods dramatically raises the risk of early death. That's from the study finds. Okay. All fried foods, especially from out there, if you have noticed it in the fast food places, they fry their potatoes in a very high temperature. You would see the smoke coming. So which means when the oil is used repeatedly, when the oil gets to a hot point that is a smoking point, it produces the cancer-causing agent called acrolein, or the acrylamide. Okay, acrolein, that's the what it is called. And it increases inflammatory bowel disease as well, not just the cardio. And high fat and high sugar can cause overweight and later on obesity. So what are the medical complications of obesity? We have the stroke. Okay. It can also cause dementia in older adults, can cause cataracts, high blood lipids, cholesterol, heart disease, lung diseases, liver disease, inflammation in every parts of our body, high blood pressure, inflamed pancreas, diabetes, cancers of all kinds, blood cancer, breast cancer, cervix, colon, esophagus, gallbladder, kidney, liver, ovaries, pancreas, skin cancer, thyroid, upper stomach, uterus. I had worked with oncology department too before in Visalia. So I had witnessed how cancer patients had gone through with their radiation. The moment they are already on that point, it is so hard to help them with their nutritional needs. But yeah, you could just see how it affects our body, cancer. It can cause blood clots. Obesity can cause blood clots. Resistance to infection. We have the unhealthy skin. We can experience gout, the bone and joint pain because of carrying the weight of the body. It can cause infertility. It can cause gallbladder disease. Okay? So lots of things can happen. Lots of medical conditions can happen when you are on the obesity side. But before it gets you to obesity, it takes you first to being overweight. And a lot of Americans are having problems like that. They all probably do. So what shall we do? The 2020 to 2025 Dietary Guidelines, this is the most current dietary guidelines for Americans. This guideline is updated by the USDA, Food Nutrition Service, to provide food-based recommendations to promote health and help prevent diet-related chronic diseases. So it doesn't matter, like I said, this is for the Americans, but it doesn't matter if you're American, Filipino, or from India, or from any part of the world, or whatever these guidelines are, can also help every individual. Okay, so one of the 4 overarching guidelines is to customize and enjoy nutrients-dense food and beverage choices to reflect personal preferences, cultural traditions, and budgetary considerations. The dietary guidelines encourage the consumption of foods that provide vitamins, minerals, and other health-promoting components, and vegetables of all types.